Good afternoon, everyone, and thank you so much for spending part of your afternoon with us. My name is Adriana Hopkins. I'm a news anchor in Washington, D.C., and I am very happy to be moderating this free From Fibroids Foundation live stream promoted with assistance by Society of Interventional Radiology. Now, SIR is a nonprofit with more than 8,000 members representing interventional radiologists and allied health professionals. In a recent report, SIR found 1 in 5 women believe hysterectomy is the only treatment option for uterine fibroids, and that 44% of women have never heard of uterine fibroid embolization. And that brings us to today's event. It is Fibroid Awareness Month, this month of July. I'm a woman who has dealt with fibroids, their removal, and the aftermath of all of it. I am one of the 80% of women who will have fibroids by the time we reach 50 years old. And it is something that disproportionately affects women of color. Now, if you are familiar with fibroids, you know they are benign tumors, but I hope you realize by the end of this event that they are not harmless. For many women, they are extremely disruptive to their quality of life, not just potentially affecting their ability to get pregnant or to carry their babies, but sexually, emotionally, physically, financially. I know women who have had to plan a work meeting or a night out around bathroom breaks. So we have several women brave enough to share their stories with you. And the question is, are fibroids treatable? Well, you can absolutely have them removed, yes, but how? There are so many options. However, women often only hear about 2, maybe 3. And oftentimes, young women, young Black women, are having hysterectomies. In many cases, those hysterectomies are unnecessary and extreme. So our goal today is to raise awareness about all the options for treatment, specifically UFE. Women can only effectively advocate for themselves, make the best choice for their lifestyle and their future goals when they're aware of all of the options. We'll also discuss HR 2007, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021, and we hope to convey why Congress needs to pass this crucial legislation. Now, before we get started, I want to invite you all to share this live stream on your social media pages, text your friends the link, drop the link in your group chats, and if you have any questions, be sure to drop those in the comments. Now let's introduce you to our first 2 panelists this afternoon, Dr. John Littman and Paula Gwen Grant. Dr. John Littman is a board-certified interventional radiologist and renowned authority in the non-surgical treatment of uterine fibroids. He has delivered over 200 invited lectures on uterine fibroids to some of the most prestigious medical centers in the country, including Harvard, Morehouse, Vanderbilt, and Yale Medical Centers. Dr. Littman is the founder and medical director of the Atlanta Fibroid Center, and he is also a key voice on non-invasive solutions to fibroids. He's spoken throughout the world and shared this solution to many people around the world. Paula Gwen Grant is a Free From Fibroids Foundation board member. She is a public relations executive with over 30 years of experience. And Paula is also a fibroid survivor. She has had 4 fibroid procedures, including 2 uterine fibroid embolizations, also known as UFEs. Paula is a longtime patient advocate, sharing her story and working to empower women to know all of their options to handle their uterine fibroids and other women's health issues. Thank you both so much for sharing your time with us this afternoon, your insight and your expertise. Now, Dr. Littman, let's start with you, and I want to answer the simple question first. What exactly is a fibroid? What makes these fibroids happen in women? Why is it that Black women are disproportionately affected? And why did you start the Free From Fibroids Foundation?
Well, we'll try to tackle these one at a time. I'll start with what are fibroids. Fibroids, as you mentioned, are benign tumors. They're the most common pelvic tumor seen in women. As you mentioned, it's very common in all women, but it's particularly common. In fact, 80% of African-American adult women have these tumors. They're made up of smooth muscle and fibrous tissue, so they're hard as rocks. And that's how they cause their symptoms. And it depends on where they're located in the uterus. So ones that are, in fact, there are 3 types of fibroids based on their location. Ones that are located right underneath the lining, those are called submucosal fibroids. Those are the ones that cause the heavy bleeding. Ones that are on the outer part of the uterus, those are subserosal fibroids. Those grow away from the uterus and press on things. So they'll press on pelvic nerves to cause pain or pressure, bloating. They'll press on the bladder if it's in front to cause urinary frequency. It presses on the colon and back to cause constipation, painful intercourse. So the bulk symptoms are subserosal, the bleeding are submucosal, and then the most common are intramural, and they're in between. And depending on which way they grow will depend on the symptoms. If they grow outwardly, they behave more like the subserosals and cause bulk. If they grow inwardly, they stretch the lining and behave more like submucosal. They'll cause bleeding, or they'll do both. And so those are the big three symptoms: heavy bleeding, heavy menstruals, pelvic pain, urinary frequency. As far as why I started the From Fibroids Foundation, as you mentioned, there's just a lack of awareness about these non-surgical options, particularly uterine fibroid embolization. We want to bring an awareness so that women know all of their options. They're entitled to know all their options. And unfortunately, gynecologists are surgeons, and a lot of them fail to mention the non-surgical options. So women sometimes are steered unnecessarily into hysterectomy. And the average age of hysterectomy in this country is less than 40. And unfortunately, I've seen way too many women less than 30 have already had a hysterectomy. It's tragic. None of them wanted it, but they weren't given any of these non-surgical options. And why it's more prevalent in African-American women is there are a number of reasons why. One, genetically, it runs stronger in African-American families. African-American women get fibroids at an earlier age. They tend to be bigger, more numerous, and therefore they're more likely to be symptomatic and more likely to get a hysterectomy than their Caucasian counterparts. They're also more likely to be hospitalized over their fibroids and in fact have a higher in-hospital mortality. So we don't want any unnecessary surgery for fibroids. We want all women to know of all their options, particularly UFE. It's outstanding. It's non-surgical. It's outpatient. It takes 30 minutes or so to perform a brief several-hour recovery, and they're discharged home not only with their uterus the same day, but with just a Band-Aid where we went in. So there's no surgery, no general anesthesia. It's all outpatient. It treats all the fibroids and is a very effective way to avoid surgery if you're suffering with fibroids.
I want to ask you, Dr. Lippman, by the time a patient comes to you, how old are they, and at what point did they hear about UFE? Because we know there is a long mistrust of the medical industry amongst the Black community. Right,
and the vast majority of my patients are African American, and so hopefully I have a long track record, over 25 years of treating patients with symptomatic fibroids. I've developed a reputation, a trust with my practice, with my patients, and they trust me to give them all the options. And we talk about the surgical options, we talk about UFE, there are a number of other medical therapies for fibroids. So it's a lengthy discussion. It's a 45-minute, maybe an hour with the patient, talking about their symptoms, going over imaging, really kind of going through all of their journey and comparing that with their imaging. We use MRI, which is a much more sophisticated imaging tool that many women have had ultrasound, which can confirm a fibroid, but we use MRI, which is much more sophisticated, to really try to put the patient's story together, because we've had patients come to us with symptoms that sound like fibroids, but they don't have fibroids. And so it's really important. They've been misdiagnosed on just plain pelvic ultrasound. So it really is important to kind of put it all together.
Absolutely. Paula, I want to bring you into this discussion right now. Can you talk about your diagnosis, when you found out about you having fibroids, how it affected your life, and then, of course, the procedures that you had to treat fibroids?
Well, it's interesting because I have had the 4 procedures, as you mentioned. I first found out I had fibroids at 23, and it was mainly because of the monthly cycle that was just out of control. I mean, it's one thing to have heavy periods, and for a long time throughout adolescence, that's what you're told. It's like, a lot of women have heavy periods. Okay, But in my family, as Dr. Lippman just said, I came to find out through discussion with my grandmother and my mother and my aunts that fibroids were in the family. So I asked my OBGYN and had the ultrasound. That's when they discovered numerous fibroids. And that was the reason at 23 for the heavy periods. Well, as time went on, I did hope to have children. I did get married, and getting pregnant wasn't difficult for me. Maintaining the pregnancy was difficult. And so I had a high risk pregnancy. In the end, after 2 preemie scares with my first child, because I did end up having 2 babies in the end, so there is hope, but it was a difficult journey. The fibroids complicated both pregnancies, lots of bed rest, couldn't work. All of that plays on our psychology as women. We're used to going, and then all of a sudden you have to stop and you have to take care of your health, because you can't ignore the fact that you have heavy bleeding every month. You can't ignore that. You cannot have that not impact your life, your relationships. My husband was very much on this journey. And we forget that our family, there are people accompanying us in our life who are affected by our irritability because of this, because of our, health not being, 100%. We aren't able to participate. We're not able to go to functions. You're not able to swim. You're not able to get in the pool. You're not able to do the beach. You're, as you said, Adriana, having to schedule your day, your life around where the bathroom is, having a change of clothes at all times in your office, in your car. You're always prepared for an accident. And by the way, you have them. I've had many of them in a boardroom where I got up and the seat was soiled because of the heavy period. You try, but these things impact your life. I first had a myomectomy, which is where you're not having a hysterectomy, you're preserving the uterus. And I was able to have my second child, and I had an easier time with that second pregnancy than the first, but it was still difficult. So then I had, again, the heavy periods. Now that the 2 children were born, still the symptoms are happening because I had so many fibroids that we were never able in one procedure to take them all out. So therefore, the presence of any fibroids kept having to, me live with symptoms. That was how I next learned from my OBGYN, who I've come to understand it's very rare, as Dr. Lippman said, that a lot of OBGYNs share all the options. But when I had symptoms again, she said, we had a myomectomy last time, but there's something new called a uterine fibroid embolization. So now I was getting a new option to treat my fibroids. And I took it because with the myomectomy, it was 6 weeks of healing. I didn't have 6 weeks to stop work. I didn't have 6 weeks with 2 children. I didn't have 6 weeks, period. I just didn't. I needed something that was a lot more friendly in terms of healing. Dr. Lippman did my UFE in 2005. And I tell you what, I was back at work day 4. And literally when Dr. Lippman says you leave with a Band-Aid, I did. I just had a Band-Aid. And when I took the Band-Aid off, I couldn't find where he had been for this UFE. There's no scarring, nothing. And then I had symptoms because, again, they were fibroids. And Dr. Lippman did a second UFE. So ladies, it's not even about only having a uterine fibroid embolization. You can have more than one if it's necessary. And that's what I learned because Dr. Lippman had to educate me on that when the symptoms showed up again. So we had a second UFE in 2008. Then life goes on. We can live, but we can manage the symptoms of fibroids. This is something that often has us women feeling powerless. You feel like you cannot do a thing about this. You feel like you just have to suffer. And Dr. Lippman has educated me to know there are a lot of us women who are called silent sufferers. We just simply deal with it. And we're not really dealing with it, but we don't know what else we're going to do. The purpose of Fibroid Awareness Month is to make us aware, and the purpose of this discussion today is to make you fully aware of all of the options that you have. You have options. You do not have to suffer silently. You can do something about your fibroids, and it doesn't have to be 6 weeks, and it certainly does not have to be a hysterectomy. UFE really worked for me and worked twice.
You
Yeah.
know, Paula, you bring up so many good points just in your discussion. I was speaking with a neighbor who I had never met before, and we were talking about our children. And I mentioned that I had fibroids. She said, you know what, me too. And we could discuss the different options for treatment. She hadn't heard of UFE, but at the end of the discussion, she said, it is so good to be able to talk to someone who's going through what I'm going through. Paula, when you talk to women, because you are a big advocate for women who are dealing with fibroids, when you speak with women, do you find that they are suffering in silence, that when you talk with them and say, I have fibroids too, kind of a light bulb goes off?
A light bulb, and then finally a big sigh of relief, because
Yeah.
what often happens is they say, me too. I didn't tell anybody. I didn't know how to tell anybody, because we are taught that we are not to discuss these things, you see. Because this is a different generation, we live in this 21st century, we have been taught that, ladies, we do not discuss the monthly event that is happening with our bodies. This is not something we talk about, but the truth is, what we don't discuss hurts us. In order for anything to be healed in our lives, we have to first speak it and face it, because then we can heal it. And so this is certainly true when it comes to our physical health, because it begins to affect our mental health, our emotional health, our relationships, the health of our relationships in our lives with our family, with our spouses. It is all connected. So you have to speak about it. And when you do, you find you're not alone. And not being alone helps a lot, because then you can find out options like this. Adriana, when you spoke it, all of a sudden now your neighbor knew she had an option she didn't have before. This is the power of being able to actually take care of this, instead of saying, well, we just have to live with it. We don't. We can live better than this.
Yeah, there was a really important study done in the Journal of Women's Health back in 2013, and it looked at women, around 1,000 of them, that's suffering with fibroids, and the average time to seek treatment was 3.5 years, and a quarter of them waited over 5 years for treatment. And the investigators at the Mayo Clinic who were running the study were kind of surprised. There's all these women, why are they waiting? They're having these horrific periods, a lot of symptoms. Why are they waiting? Well, when they drilled down on it, they didn't want surgery. They didn't want hysterectomy, and they weren't given any other options. And so there are over 1 million women right now in the United States that are on the sidelines. You call them the silent sufferers. That's what we call them. And they are unaware of any other option, and they don't want surgery. I don't blame them. I wouldn't want a hysterectomy for benign disease. For cancer, hysterectomy is appropriate, but fibroids are benign tumors, as we mentioned. So why in the world are we doing so many hysterectomies? In fact, it's the second most common surgery performed in the United States, and it's most commonly done for fibroids. And again, the average age is less than 40 years. And so we've got to really kind of increase the discussions. If your mom had fibroids, you are much more likely to have fibroids too. Obviously, if you're a woman of color, you're more likely to have fibroids. And so hopefully we can generate some discussions amongst family members, amongst friends. We've got to really, empower women with the options that they have now that they weren't aware of. And particularly, as you mentioned, UFE, it's an incredible procedure, but nobody knows about it.
My grandmother had a hysterectomy, Adriana. My grandmother, to treat her fibroids in the 1960s, the only option available to her, as Dr. Lippman is saying, was a hysterectomy. My grandmother had only my mother, one child. That was it. And the fibroids kept my grandmother home, because she was a working woman in the 50s and 60s and 70s. And she would stay home from work, as women do right now, on average 1 to 2 days a month, behind the heaviness of her period.
Oh, yeah.
And my grandmother said to me, I'm so proud of you, because you didn't let these fibroids stop your life. You're doing something about it. And you're fortunate to live in a time where you have options, and you never had to get the hysterectomy, because hysterectomies have consequences. It's not like after the hysterectomy, life is going to be great and you're just going to go on and snap back to the healthy, younger you. You're going to have symptoms and lifelong effects on your body from that hysterectomy. Right, Dr. Lippman?
Exactly. I mean, so many women come into my office who have been told by their physician, their gynecologist, healthcare provider, that once they're done having their children, they no longer need their uterus. And that's just ridiculous. I mean, I heard somebody say, yeah, well, they told me I didn't need my uterus anymore. And the silver lining is I don't have any more periods. And that's wonderful. And I'm like, well, when I hear that, the silver lining is like, it's like saying earthquake. The silver lining is more construction jobs. I mean, no. When you undergo a hysterectomy, there are a lot of women that struggle. They struggle psychologically, like a man being castrated. They can struggle sexually. There's a lot of sexual dysfunction. And again, you talk about stuff people don't talk about. You're not going to talk about the sexual dysfunction after hysterectomy, loss of libido, loss of orgasm, what have you. There's a lot of urinary leaking. You take this big fibroid-filled uterus. In fact, women are often described as a certain size pregnancy when they have fibroids. If it's up to their belly button, that's a 16-week, 4-month size uterus. When you take this big and large uterus out of the pelvis, it weakens the floor of the pelvis, weakens the pelvic floor muscles. And now these young women in their 30s, maybe 40s, are wearing adult diapers. They're leaking urine. And so we don't need to do any hysterectomy should be the option of absolute last resort, not first and only. We've got to change that.
Mm-hmm.
And when we change it, it's empowering. When we change it, it's empowering, Adriana. And that's where we need to shift our mindset from feeling powerless and suffering because of our fibroids, like something is wrong with us, like we're not fixable, like this is something we can't, instead of feeling like that, why don't we instead realize that we have options, and the options are good that we're thinking about, and we can actually get our life back and feel good. Because after the UFE, I had my energy. I did not have those heavy periods. Everything straightened up after the UFE, and I felt like my old self, and back came my energy and my self-esteem. So this can be empowering when you know all of your options and not only presented with the options that are not going to be good for your life.
When we say free from fibroids, that free is freedom from a lot of things, kind of that mental anguish, that physical pain, the actual sight of the bleeding all the time, constantly. We had talked, prior to this about the financial impact that people often don't think about. But if you're someone who's bleeding for 10, 15, 20 days, you're buying a lot of pads, tampons. And as you said, that affects your finances, your relationship, your self-esteem, your mental anguish, all of it. Am I good enough? What did I do wrong? What's the problem? Dr. Lippman, you touched on a lot of things. My mom had fibroids. I never knew until I told her I'm having a myomectomy. Now we're talking about it. It's not something that was really ever on my radar at all. Let's talk about HR 2007, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act. This is a crucial piece of legislation. Dr. Lippman, why is it near and dear to your heart?
Well, it's legislation that's so important. We have relatively neglected fibroids in the research arena. We still don't know where fibroids come from. We know that they grow with estrogen. That's why they can grow rapidly during pregnancy, and why, for the most part, when a woman is in menopause, fibroids are typically not an issue, although sometimes we will treat some postmenopausal women. But for the most part, when you're in menopause, fibroids are no longer an issue. And we've just not ever put the money into research of finding where do these fibroids come from. We know the chromosome involved, but we got to get to the gene level. If we can get to the gene level, then you can start affecting therapies and get on the preventive side of things to look at women that are likely to have fibroids and try to prevent them from getting fibroids. So HR 2007 does two really important things. It first provides much needed research funds to the NIH. It's $30 million a year for 5 years. It's a good start on where fibroids come from, and also studying the relevant population of people that get fibroids. One of the frustrations when looking at some of the literature on research for fibroids, predominantly Caucasian women. African-American women get fibroids 80%, and we're studying almost studying the wrong women. I mean, women of other, Caucasian women do get fibroids, just not to the degree. So we'd like to study more women of color in our research. And then the other piece of it is directing the CDC with educational materials to primary care physicians and the general public on the different treatment options, including UFE, so that doctors can inform patients of all their options and the public can know all their options about fibroids.
And Paula, what do we all need to do regarding this piece of legislation, the awareness of fibroids and treatment and empowering women?
We have to think of it like breast cancer awareness. It is yet another women's health issue. So why don't we approach fibroids, this other part of our body, the way we have approached the breast, right? Which used to be taboo to talk about that. Before breast cancer awareness became so prevalent and accepted by society, and now we have buy-in to even the NFL is proud to wear pink socks and pink shoelaces on their cleats. That's awesome. Let's approach fibroids the same way, because if and when we do, especially with this legislation, the awareness will then first get us all talking about it. By us talking about it, remember, we can heal it. We heal it by having all the options that are available to us, so that depending on your stage of life, and if you want to still have babies, but the point is you do want good health, we can get to that when we have the answers from the research. That's how it happened with breast cancer awareness. And while they're on their way to a cure, this is something, as Dr. Littman has just educated us all, these are benign tumors. So how about we find out how this happens? Let's get on the side of preventing. These are the answers our grandparents didn't have, our aunts didn't have, but now we can have in this generation when we put the attention on the fibroid issue from a medical research standpoint. Let's get this legislation passed by all of us contacting our legislators. So this is something you can do. You go and you find out online who your legislators are, and you call, you contact, you email, you call them, and you say, this is important. Here's why. This is something that's fixable for the women in your life who you may not be aware of are suffering from these symptoms of fibroids. This is something we can do. Contact your legislator and tell them to support this legislation.
Absolutely. And Paula, you're right. This is something that we can fix. We can come to a solution on this. It's not so far out of our reach. It's right there. And so that's why it's really key that everyone take the time to do, as Paula said, reach out to your legislatures and make sure that they are aware that this is something that's important to their constituents. Because when we tell them what to do, or else we'll withhold our vote, that's when they start to listen. Dr. John Littman, Paula Grant, thank you so much for your time this afternoon. Hang tight because we have another panel coming up, and we'll get back to you at the end of the program.
Yeah, if I could say one more quick thing, my legislator, David Scott, is one of the co-sponsors. And so what people can do is not only ask, for support from their legislators, but also to co-sponsor and join David Scott and Yvette Clark and others that are part of this bill to join a coalition of legislators. The more they have, the more likely this is going to pass.
Absolutely. All right. Thank you both. Coming up, we have a second panel, this of patient advocates. These are women who have endured fibroids during their lifetime. Our first guest is Geraldine Joseph. She's a 38-year-old woman who had all of the horrible symptoms that we associate with fibroids. Gynecologist said that surgery was the only option. Now, she brought up UFE to her gynecologist, who was dismissive of her. Now, dealing with fibroids for a long time, she didn't know that she had it until she saw The Real Housewives of Atlanta. Cynthia Bailey was very thorough and open about her experience with fibroids there. And she said that at first she was told she needed to live with fibroids until she was ready to have a baby. But of course, she had the UFE procedure and did fabulous. Our second guest is Desiree Pender. She also has had fibroids. She's resident of the Bahamas, and she travels between the Bahamas and Atlanta. She also had all of the symptoms that you think of, particularly the heavy bleeding. Now, she saw 3 gynecologists, all of whom said that she needed a hysterectomy one immediately and tried to schedule it right then and there. She too is a new woman after the UFE procedure. She owns her own business and had to manage taking meetings while suffering with fibroids. And people said that she looked pregnant when she had fibroids. She knew women who had a hysterectomy and the side effects that they dealt with. And she said, that is not something that I want to go through. Our third guest is Trishy Cross. She is a 38-year-old woman who had all of the symptoms as well. She wore adult diapers due to bleeding. She had pain on a scale of 1 to 10. She was at a 9. She had urinary frequency and she was waking up 5 times or more during the night to use the restroom. Now, she said that UFE was amazing and life-changing and wish she knew about it and had it done years ago. She works as a paralegal for 2 different lawyers, and of course, missing work for 6 weeks, not an option. She does not want to have kids, but she did not want to have her uterus removed. Her mother and her grandmother both underwent hysterectomy for fibroids. Thank you, all 3 of you, for being here with us this afternoon. I just want to start hearing from Geraldine. Let's start with you. Talk about those symptoms that you had to endure and how long you endured them. And was there any point that you learned, oh, I have fibroids, this is what's causing this? Did you go for a long time without knowing what was causing the symptoms?
Yeah, for me, my symptoms were discomfort in my pelvic area. And I remember one day I went to my OB doctor and she was applying pressure. And I said, what is that? This is not normal. She decided to do an ultrasound in her office and come to find out I had multiple fibroids in my uterus. And so they weren't as big, they were different sizes, but she wanted to monitor it. Unfortunately, they grew. They grew a lot. And I had to figure out ways of figuring out what I'm going to do. Didn't have the options of UFE, but I did get the option of having it surgically removed, which is something I didn't want to do. And like, again, like you mentioned, I did bring up the UFE and it just was not an option for them. So I remember watching Housewives of Atlanta and seeing Cynthia Bailey, and she was just talking about her journey. And I said, this is me. I'm consistently bleeding, over bleeding when my cycle is on, constantly going to the bathroom because I just can't control my bladder. It was just so much. It was just a big discomfort. And when I found Dr. Lippman and spoke with him, he was able to give me more information about what UFE is and how much it can help me. And I decided to go for it. And here I am.
You know,
Doing great.
Geraldine, you bring up a good point. You know, the paranoia is a factor that a lot of women don't necessarily recognize or talk about, but that paranoia of like, oh, am I bleeding through? When I stand up, am I going to leave something behind? That's something that it just kind of drives you crazy. How did that affect your ability to do your job?
Oh man, it was horrible. So I am a front desk receptionist. So you can imagine me being up front and something as far as having a bad accident, it's very embarrassing. So I did encounter 2 situations where I had to dodge, but unfortunately the second time it happened, I didn't get a chance to dodge by. But I had to bring change of clothes or go home early just to change. It's very uncomfortable. It's very annoying. You get tired of it and it's embarrassing. And no woman should have to go through something like that all the
And obviously, if you're the person at the front desk welcoming people into an office, you can't pop up every 5 or 7 minutes to the bathroom to check and see what's going on. Desiree, I want to bring you into the conversation. Can you tell us about your journey with fibroids, when you were diagnosed, the symptoms that you were experiencing, and how it affected your life?
Well, I had my first child, an only child at 25, and had the baby, and they said, oh, you have 2 little small fibroids, but we scraped it away. You're going to be fine. And a couple of years later, in my 30s, my period was super heavy, plenty pain, can't go out of the house, urinating every second, it seemed like, and have to be padded up and skirted up. Whenever I go out, I would definitely make sure I have something tied around me just in case. And it was just too much on me. And I decided to take a look into it, went to see gynecologists, and they wanted to do a hysterectomy, and I didn't want to do that. And I just went online and started some researching until I found Dr. Lippman.
Can you talk, Desiree, because you mentioned having to always have something around your waist and thinking about it all the time, and it became too much for you. Can you speak to the mental toll that having fibroids took on you?
Well, I know as far as a relationship, it was awful. So I didn't have one for a very long time with that. But yeah, it's, you go out and you figure, am I going to mess myself up? And, will people look at me funny? And as females, you don't want to be out and that happen. So yeah, it works on the mind a little bit, and to be at home 10, 15 days in the house because you're afraid to go out. And when you go out, you have to carry plenty items just in case. Like she said, a change of clothes. You're going up the street for a couple hours and you have to take a change of clothes because you don't know what can happen. So yeah, it's plenty on one person mentally.
Mm-hmm. Now, Ms. Cross, I'm going to bring you into this conversation as well. How did you find out that you first had an issue, and when did you find out you first had an issue?
Well, I've always had heavy periods, heavy, painful periods, even as a teenager. So I just thought that was normal. And then all of a sudden, one day I noticed, like I was laying on the couch and I noticed a huge lump, like in my abdomen. And of course, that freaked me out. So I tried to get in to my regular doctor, couldn't get in. So I went to urgent care and they did an ultrasound and that's where they found the fibroids. So after that, I, of course, had talked to my mom about it, and my mom herself had fibroids and she had hysterectomy. Her mom had fibroids and had hysterectomy. And on my dad's side, my aunt had fibroids and had a hysterectomy. So I was already anxious about the possibility of having to go through that, having seen what they went through. So I finally got into my gynecologist and she, confirmed you have fibroids. And we went through the options, hysterectomy and myomectomy were, of course, the big two that she pushed. She did mention the UFE, but it was just more like, well, you're still going to have the fibroids, why not just take care of them? Like, you get the hysterectomy and they're done. You get a myomectomy and we cut them out, and you can keep your uterus. But with UFE, that's an option, but you're still going to have them. And so I remember, just like Geraldine, I saw the Real Housewives of Atlanta with Cynthia Bailey. And I'm like, what did Cynthia have? And so I started doing my research, and that's how I found Dr. Lippman. And I immediately made an appointment with him, and he said I was a good candidate for the procedure, and it worked. Best choice of my life.
I want to talk to you more about this conversation that you had with your doctor versus Dr. Lippman. It seemed like the gynecologist you spoke with was very kind of dismissive of UFE. How did the conversation with Dr. Lippman progress, and what really kind of sold you on this procedure?
Well, for one, the recovery time. I cannot be out for 6 weeks. I work at a small but very busy law firm, and if I'm out on vacation for a week, things almost fall apart. But for 6 weeks, that just was not an option. And to add to that, I'm single and I live by myself, so it's like, are my parents gonna have to come stay with me for 6 weeks to help? I have to get some of my girlfriends to rotate coming to stay with me. It was just logistically, it was just 6 weeks was not an option. And so the recovery time was one, and then two, just not having to have an invasive surgical procedure. I do not want children. I don't. But I also don't want to undergo an invasive surgical procedure if I don't have to. I saw 3 women in my family, recover from hysterectomies. And it's a rough recovery. It's not like, snip, snip, your uterus is gone, and then, you're up and running around and doing everything. I remember seeing my grandma cry from the pain, So the short recovery time, and the fact that it was non-invasive and that I would keep my uterus, after hearing all that from Dr. Lippman, I was sold.
Geraldine, I asked you the same question. What sold you on the procedure UFE for you?
Oh man, just not having to go through the knife. I definitely don't want any kind of scar. And of course, I want to have kids. So definitely I want to have it naturally. So C-section was not an option for me. Getting cut open, it was not an option. So having something as a UFE done was the best decision. And let me tell you, I'm from Florida. So I took a leap of faith driving from Florida with my sister to go to Georgia to do this procedure. And that was the best investment. I think every woman should invest in themselves when they're dealing with fibroids.
I totally agree. Desiree, let's talk about the recovery process for you. How did that go?
Well, it was very short. 2 to 3 days, I was up and moving. And that's good because I'm self-employed, so I can't sit down for 6 to 8 weeks. And the Band-Aid had me, because when he said it's going to be a very, very, very tiny incision, I was like, I'm good to go. And I came from the Bahamas for this. And I spoke to him off and on, making sure that we're still on. So, yeah.
Absolutely. Ms. Cross, let's talk about, when you speak with other women about this procedure, this experience in fibroids, do you find that a lot of people are enduring this and no one's talking about it?
Oh, yes, totally. I've talked to a number of women, who are going through what I went through before I had my procedure, the heavy periods, the having to wear adult diapers to bed so you don't, have an accident and ruin your bed, and yeah, they think, hysterectomy or myomectomy is, those are the only 2 options, and even when I was talking to my aunt, she was just amazed that, just amazed by the procedure because she herself had a hysterectomy already. And she's like, I wonder if that was around before I had my hysterectomy, but it's definitely something that a lot of women deal with. And everybody needs to know that they have options other than having your uterus removed or having an invasive myomectomy.
Mm-hmm, mm-hmm. What's life been like after this procedure?
So much better. No more adult diapers to bed during my period, for one. I used to have to plan things around my period. Like if I take a trip somewhere, I would have to, no, I can't go that week. That's going to be my period. It's been life-changing. Like, everything that everyone else said, like a backup pair of clothes or underwear and, constantly having to go to the bathroom like that. It's non-existent anymore. It's been such a good experience. And, I wish I had done it sooner. Had I known I had fibroids sooner, I would have done it much sooner because it's just really, really improved my quality of life.
Desiree, you're a patient advocate. When women come to you and kind of, spill all of the issues they're having, of course you can relate. What are you telling them? What are the words of encouragement you're telling them? And what are you telling them about UFE versus hysterectomy and myomectomy?
Well, the first thing I try to let them know is that it's a very quick procedure, very quick, less downtime, have it done. To have a hysterectomy it's horrible because I have friends that have it. They have sweats, mood swings, sexual issues. So my encouragement is have it done. And I would personally bring them to have it done.
And that is a major endorsement considering you are coming a far way to have it done to see Dr.
Yeah.
Lippman.
And I
Geraldine, I'll
told
ask
them that too.
you
And I
told them that
them
too.
yeah, I told them, I said, I will personally bring them and they can stay with me to have it done. That's how serious I am with it.
Yeah. Geraldine, I'll ask you the same question as the patient advocate. What is it that you're telling women who are in the thick of this fibroid journey when everything is, so dark, your mental anguish is at all-time high, you're financially crippled by all of the pads you're buying, the clothes you're throwing out, the bed sheets you're throwing out, the adult diapers you're paying for, when your relationships are suffering, not just with your partner, but also with your friends. I mean, your friends may invite you out and you're the person who has to say, well, no, I can't make it, because you just don't want to have to go through all of the rigmarole of getting everything together to go out for a couple of hours. What is it that you tell women who are currently in the thick of their fibroid journey?
And listen, I'm a big advocate of of UFE, and saving your uterus is so big. It's so important to me. So when I come encounter with women who are dealing with the issues that I have, I explain to them, you have options. You have options, and if you're really interested in getting this fixed, I would explain to them, Google UFE and do your research. Do your research and know that there's options out there besides having a hysterectomy, or a myomectomy. And just being supportive. I'm a big supporter, like the lady said before. I would do the same. I would definitely do the same as far as supporting and just being present and just being a voice for those that just aren't aware of it. Yeah.
Absolutely. I'm going to keep you up right now. What is it that you want doctors and legislators to know about UFE, hysterectomy, myomectomy, fibroids? What would you have them know?
I would like to let them know that procedure, not surgery, but this procedure works, and that they should make this as an option, a first option for us, instead of having the others, being like a hysterectomy or so. So I think for doctors, they should be more educated as far as understanding how UFE works and how effective it is for us, and just making it as an option for us to do first. And then if that doesn't work, if we're not happy with it, then we take the other options. But definitely UFE works.
And that's really the key to being empowered, is to knowing all of your options and choosing what's best for your lifestyle, what's best for your career, what's best for your future goals. I want to thank all three of our patient advocates for joining us this afternoon for this event. Thank you so much for being brave enough to share your story. You have to come from a very vulnerable place to express all that we endure when we're going through our fibroid journey. So I want to thank you for being brave enough to share your story, and thank you for sharing your time, of course, with us this afternoon. Certainly appreciate it.
Thank you.
Thank you for having us. We appreciate it.
Thank you.
So we want to share with you a video right now of a success story of the UFE procedure on a woman who had fibroids. This is one of Dr. Lippman's patients. Excuse me, let's take a look.
She was 38 years old at the time and suffering with fibroids, and was told by her gynecologist that she had to have a hysterectomy and she was never going to have a child, and just to give up that dream. She really wanted to try to have a child and was crushed by this. But I told her, I don't know if you'll get pregnant or have a child one day, but I am confident that I can help you. We treated her with a procedure called uterine fibroid embolization, completely non-surgical and outpatient. Her symptoms went away after the procedure. She met a man in church. They started dating, they even got married. And lo and behold, they had a child. And she sent me a really nice heartfelt letter thanking me. She had her miracle baby and she was thrilled. And then several months ago, there was a knock at the door of my office after I had finished seeing patients, and she wanted to show me something, said, come on outside. And out of the car popped her miracle baby. He had just graduated from high school, and it was just a great moment. I'll never forget it. And She was so thrilled, and she said, I was this close to getting a hysterectomy.
And Dr. Lippman, that's just one of many stories of success of this UFE procedure. You actually keep a picture of that miracle baby, at the teenage version, in your office.
I have the baby picture. It's part of a talk that I give with the letter that she wrote me, and it's just one of a number of just heartfelt stories. When women's lives are transformed, it's incredible. And then on top of that, have the miracle of childbirth, when you were told that that wasn't going to happen for you and you just had to have a hysterectomy. I mean, it is a great story. And this is Jalen. He graduated high school, as I mentioned in the video. He was the one that was driving the patient to my office. And so I want to reiterate my thanks to the other patients that are joining us today. The courage that they had to tell their stories. I'm very grateful, and hopefully that will help a lot of other people telling these stories and getting the word out about this. So I'm very thankful for that. I'm also want to make sure people understand it's not just me doing this procedure. I mean, we've seen a number of my patients, and the video was a patient of mine, and Paula was a patient, as she mentioned, but this procedure is available throughout the United States. It's done by interventional radiologists who are specially trained in these minimally invasive procedures that replace surgery. In this case, we're replacing surgery for fibroids, but interventional radiologists are doing amazing things for cancer, for peripheral vascular disease, a whole host of medical conditions. And we're a very unrecognized specialty. That's part of the problem. People don't know interventional radiology. It's really important to learn about that specialty and really get to know interventional radiology, because likely they can save your life, they can replace surgery, and really be very helpful. So just a couple other quick things that were brought up during the patients that you were talking to. One had mentioned that you do still have fibroids, which is correct. After a fibroid embolization procedure, all of the fibroids are knocked out, they're dead. And the way we do that is we direct a little tiny catheter into the uterine artery, and there's one on each side, and we deliver these tiny particles that block the blood flow to fibroids. If you think of the uterus as a tree, there's a uterine artery on each side, and each is a tree, and it branches, getting smaller and smaller branches till you get out to the leaves. The fibroids are the leaves of the tree, and I know what size those tiny peripheral branches are, and I can plug them up. And without a blood supply, the fibroids start to die. The big trunk and the main uterine artery, it stays open, the uterus stays alive, and that's how we've had a number of children after UFE. In fact, our births are typically full term and vaginal, whereas if you have a myomectomy, you're going to get a C-section, more surgery. But so the fibroids will start to soften and shrink. Now, some of them will disappear. Sometimes big ones disappear, but all they have to be is dead, and they won't bother the patient anymore. Because most women that have fibroids have them. They don't cause symptoms. They don't need to see me or an interventional radiologist or a gynecologist. If they don't cause any symptoms, you don't need to treat them. And so we call those fibroids passenger fibroids. They kind of ride along in the uterus. The woman doesn't bother them. They don't bother the woman, and she dies with them. What we want to do with UFE is, as you heard from the patients, those are not passengers. Those are causing significant disabling symptoms. And so what we want to do is convert a woman who has these significant fibroids into smaller dead passengers. It doesn't bother them anymore.
Makes perfect sense. I do want to kind of talk to you a little bit more about hysterectomy, Dr. Lippman, and the history of the hysterectomy, and why at this point it's such a prevalent procedure in the US.
Well, it's the second most common surgery done in the United States, which is a little surprising because half the population doesn't even have a uterus. And the most common reason is not cancer, which would be appropriate. If you have uterine cancer, hysterectomy is the treatment option. But instead, the most common by far is these benign tumors, these benign fibroids. And so we really have to kind of stop and ask ourselves, why are we doing essentially an amputation? We're removing an organ a woman was born with over benign disease. And so that's really where I think the discussion needs to start. Like, why are we doing this? And it's also, who is it affecting? Well, it's affecting a lot of women, but it's particularly affecting African-American women. And when you start talking about something that is really directed primarily at women of color, and you're amputating these women, obviously it's going to elicit a lot of the feelings of mistrust of medicine, whether you're talking Mississippi appendectomy or Tuskegee or, a whole host of these very unfortunate, tragic events start to percolate up. And you have to ask yourself, okay, you can't dismiss it. You got to recognize it. And I'm hoping that we're not seeing that because of the history, and we're learning from history, and we can get beyond this.
Absolutely. Hence why HR 2007 is so crucial and so key. I want to bring Paula back in to kind of give a call of action to everyone who is watching this afternoon in terms of what, again, we can all do to make sure that this legislation passes. And it looks like we may have lost Paula, maybe with some technical difficulties. So again, we did lose Paula, but again, Dr. Littman, that legislation is so crucial because it really is about research. As you mentioned, fibroids affect 80% of women by the time that they're 50. That's a huge part of the population. And we just don't know much about fibroids because there's not a lot of research done. So again, advice for those who are watching to help push this legislation through Congress.
Yes, please support HR 2007. It provides research to try to find out where these fibroids come from. It's our best chance to get on the kind of preventative side of this, to really understand about fibroids, to really get the best treatment options for fibroids. It also directs the CDC with educational materials, which are so important about all the treatment options for fibroids, not just the surgical ones. So there'll be a lot of educational materials, not only to the public, but also to primary care physicians, family physicians, even the gynecologists that will see these patients come to them in their office, and they'll be armed with all the options. And so women are entitled to know all the options. Currently, for the most part, they're only hearing the surgical side of things, and we want to change that. And this legislation is a good first step. Contact your legislator, try to get them to be a co-sponsor. The more co-sponsors we have, my legislator, David Scott here in Georgia, is one of the co-sponsors. Yvette Clarke is kind of spearheading this on the House side. There is a Senate counterpart, which our vice president was the lead on that when she was in the Senate. It's now being championed by our senator here in Georgia, Senator Warnock. And so hopefully both House and Senate will pass this legislation and the president will sign it, and we can finally start the process of understanding fibroids better, getting better treatment options for women. And frankly, they deserve it.
I completely agree with you wholeheartedly. I want to end this event with a message of hope for all of those women who are watching, who are possibly enduring this fibroid journey. I want to let you know that there is a light at the end of the tunnel. Hysterectomy is not your only option. Myomectomy is not your only option. Birth control in perpetuity is not your only option. There are other options out there, UFE being a crucial option that you should have on your plate to choose from. I want to make sure that when you go to your doctor, you have done the research, you have done the work, you were asking your doctor about all of the options. If your doctor is dismissive, as we've heard our patient advocates say, find another doctor. There is definitely someone there out there who will hear you, hear what you're going through, listen to your life goals, listen to what you want out of treatment, and they will get you the treatment that you need and that you deserve. We have a lot of work to do as a country in terms of empowering women and paying attention to women's health. I want you to know there are people working to do that. That's why we're having this event today. That's why July is Fibroid Awareness Month. That's why we're out here spreading awareness about fibroids, letting you know that you're not alone. You're not the only ones out there enduring this journey, and letting you know that there are people working on your behalf to empower you to make the right decision for you and your life. Hang in there. I know it's tough, but the solution is at the end of the tunnel. The light is at the end of the tunnel. And on the other side of it, much brighter, happier, lighter period days. I want to thank all of our panelists for being here with us this afternoon, Dr. Littman, Paula, all of our patient advocates. Thank you so much for sharing your afternoon, sharing your story, sharing your expertise and insight and advice. And thank you all for joining. Take that call of action, contact your legislators, and let's get this legislation passed. Have a great day.